Hey everybody, this is Brandy checking in for my community health project video, and mine is about obesity issues and prevention. Obesity has been a growing concern in the United States for decades and continues to be a leading public health issue. Obesity has more than doubled since the 1970s. And so what are the causes and what can we do about it? There's a number of obstacles that we face in society that contribute to obesity. Some of these are stress, lack of time, cost of healthy food, advertising, and willpower. I interviewed 2 women from work, and both of them struggle with these issues in keeping their weight at a decent level. Let's talk about advertising of food for a minute. One advertisement stood out to me, and that was the advertisement for the Arby's 3-cheese steak sandwich. Now, Arby's has a slogan, "We have the meats." And when you see their ad, the meat is just so juicy and it looks so good. I mean, if you're not a vegetarian or anything, it looks good. You might get tempted to go out and buy one of these sandwiches. But what they don't tell you is that it's 650 calories, and that's just for the sandwich. Now, if you want a curly fry to go with that, and I'm talking a medium curly fry, you're going to add on an additional 550 calories. And then if you want a soft drink with that, another 250 calories. So you could eat over 1,400 calories in just one Arby's meal. Arby's isn't the only fast food company that does this. There's so many, and that's just one of them. So these enticing ads can really pull you into making some really bad food decisions. Another thing is people have less time to plan their meals and how they're going to spend their money. People are busy, they're at work, they're raising kids, they're spending time in traffic, they're getting ready for their day. Some of them, like me, work a full-time job with overtime hours and is also a half-time student. So it's hard to find time to plan your meal, but some people are able to do that. I've seen people cook one night and then they plan their meals out and they put them all in these little Tupperwares and they have their whole next 2 or 3 days ready to go. I don't have that kind of time. I did 18 hours of overtime last week. So some people just don't have that luxury. So that's a growing concern today as well, as Americans work more than most people in the world. Another thing is buying healthy foods is much more expensive than fast food or processed foods. So people who are in lower income areas of society are going to have that obstacle of, or limitations and choices. They're only going to be able to afford the unhealthy stuff. Some families don't even have access to supermarkets. Children who are obese are at risk for high blood pressure, insulin resistance, breathing issues, joint problems, fatty liver, gallstones, depression, gastrointestinal problems, low self-esteem, and low quality of life. Some communities lack a safe, appealing place for kids to play and be active. It is estimated that half the kids in America don't have parks, community centers, or even a sidewalk in their neighborhood. Portion sizes have also increased over time, and research shows that kids will eat more without even realizing it if given a larger portion. Some obstacles are finding time and motivation. One of the women that I interviewed said that her self-esteem is really low and it prevents her from pursuing relationships. So it can also affect your relationships, it can affect your marriage. If you maybe met someone when you were in shape and you gained a lot of weight later on, they might not be attractive to you anymore, and that can ruin your entire relationship. So obesity is a huge issue in our society and in our relationships. My Uncle Ray, who's a retired nurse of 15 years, says that parents who are socialized to eat large quantities of food pass this practice on to their children. Symbolic meanings attached to food as a result of experience from infancy and childhood. During stress, some people eat more food or high caloric foods. Basically, people go to compulsive eating. And some people will eat because they're depressed or stressed out. And this is called emotional eating. Early education and awareness in schools, churches, health institutions, social media, and local and federal government programs can help fight obesity in our society. We have to incorporate exercise programs in schools, businesses, and workplaces so we can provide the convenience to people who are lacking that elsewhere. Also, affordable healthcare options being accessible to everyone in society, no matter what their class is essential. My Uncle Ray also adds that time, money, and willingness are on the individual. So part of it has to come from you, the individual. You have to find it within yourself to do something about it. Health educators use a trans-theoretical model, or TTM, to help with counseling of patients. The first stage is called pre-contemplation. At this stage, you have no intention of changing due to lack of being aware or from not being informed. The second stage they call contemplation, and people in this stage are aware that their behavior is a problem and they want to do something to change it. That's probably where I'm at right now in life. The third stage is preparation, and in this stage, the individual believes they can change and are making plans to do so. At this point, they've joined the gym, they've started calorie counting, they've cut down on alcohol, and they're starting to plan their meals. The last stage is called maintenance, which takes place after 6 months of practicing new behaviors. And at this point, you're just trying to prevent any kind of relapse. You're avoiding the triggers that could turn you back to your old habits. It's not easy, but at this point, you are committed. So basically, that is the end of my community health project. Education and starting when you're young, raising your kids with good, healthy eating habits is essential to maintaining that throughout their life. So at this point, I'm going to end my video. I hope everybody enjoyed it, and I hope everybody enjoys their holiday season. Bye.